Welcome to the Sense of Hope podcast by One Life. I'm your host, Helen Diveston, and today we have Jo Battye. Jo is a general practitioner based in Christchurch, New Zealand, who graduated from Sheffield University in the UK in 1995. She became a Fellow of the Royal New Zealand College of General Practitioners in 2003. Despite Jo experiencing a journey with endometriosis and IVF, she was lucky to have 2 children in quick succession in 2005 and 2006. While pregnant with her first child in 2005, Jo studied a Certificate of Interpersonal Psychotherapy and Child, Family and Adolescent Mental Health. Her passion and commitment to providing good mental health support as a GP was seeded from her own experience, the suicide of a close family member who was only 12 years of age. In her latter years, Jo trained as a Mind Detox Master Practitioner, Calmologist and Prekure mental health coach. More recently, Jo has completed the Certificate in Psychedelic Assisted Therapy, PAT, with Mind Medicine Australia, is training in internal family systems, and is currently involved in psychedelic research in New Zealand Aotearoa. Jo has been influenced by the work of Professor Julia Rutledge from the University of Canterbury, Lissa Rankin, Gabor and Bessel van der Kolk. Jo continues to work as a virtual GP so that she is able to support vulnerable communities. Jo is passionate about supporting women through struggles and transitions to create harmony with natural cycles so that women can thrive well into their wise woman years. I really like that. Jo is committed to offering education, advocacy and integration therapy with a hope that we have safe, affordable and effective use of psychedelics as therapy in the future. Jo endeavours to bring the heart back to medicine, ensuring that people feel seen, heard and understood. Jo understands that optimum mental health outcomes involve wraparound community support, good nutrition, movement with somatic experiencing and biohacking the vagal nerve. Welcome, Jo, to the Sense of Hope podcast.
Thank you for
Thank
the
you.
invitation.
Yeah, I'm very excited about this topic. And we are going to be talking a little bit about psychedelic therapy. And one of the first things I really want to emphasize to the people listening to this is that we are talking about psychedelic therapy as a therapy that's actually used in a legal sense, not what we would call underground or illegal use of psychedelics. So I think it's really important to put that out there right in front, and just to remind you when you're listening to this podcast that this is a very safe way of using therapy, and we'll talk a little bit about that as we go through. So Jo, one of the things I'm curious about, I've listened to this introduction and who you are, and I think, well, obviously at one stage you were just an ordinary GP doing ordinary practice, and then somehow you've really embraced a different way of working. How did this change for you, and what was it that brought you into a different way of practicing medicine?
I think it was a gradual process of disillusionment with the medications that are currently available. I actually had a psychiatrist I was working with who was also feeling quite despondent and admitting that nothing really works.
It's quite a scary thought, really, isn't it? Like, here you are with all this knowledge and all this training, and to be told that, oh, well, actually, yeah, it's probably not that effective.
So following the breadcrumbs, I was privileged to do the mental health coaching. So I guess it's been a process of letting go of the traditional identity as a doctor and coming back to myself, my values, my experiences, and practicing more as a coach. So walking alongside people and dropping the robotic scripts of my training and sharing some of my vulnerabilities with the process and what's helped me. So just sharing practices that have been supportive to me, not just talking from a textbook or a training, but really walking my talk, I think, is really important to me as a practitioner. I believe it's the daily practices that we put in our life. I want to share about the beauty way is choosing to perceive beauty in our life. Mm-hmm. So coming back to the simple things that give us wonder and awe. The looking at the stars, noticing the blossoms on the trees at the moment. People are so busy, and it's so on it. It's like the busy badge.
Yeah.
And it's like, whoa. So I will drop it in. So my daily practice is making a cup of cacao. For over 3 years, that's been a daily practice. That's chocolate, but pure whole bean chocolate, really helping me ground myself into my body, into my heart. So it's got theobromine that is heart opening. So part of my process in learning about psychedelics, my path of tuning into all plant medicines. So coming back to the medicines within nature, tuning into what the grandmothers, the great-great-grandmothers would have done, away from this packaged food and this drive that seems to be in our society to acquire things that once we have this, we'll be happy. And I think it was the science of happiness that I tuned into. It was like that happiness from buying things is so short-lived, but it's actually our experiences that give us lasting happiness.
You called it the beauty way, is that correct?
Yeah, so what we focus on grows.
Yeah. So it's a bit like the modern day thing is like I've been taught about gratitude or finding the joy. My thing's about finding the joy in the little things. So it sounds very similar. Just stopping and noticing, what can I notice right now? What can I think about that I'm thankful for in this moment? So name 3 things that I'm thankful for. Or what can I notice right now is something that brings me joy, or that I find, gives me a bit of awe. So it sounds quite similar, and it's actually a very powerful exercise.
Yeah, so I think it's also those self-care and choosing what we wear and being able to shine in that way. And so it ripples out. And I find just choosing a compliment, noticing that beauty in other people lights them up, and then it can ripple out. So really trying to be the change that I want to see in the world. So I'm quite passionate about social justice as well as advocating, educating, and health literacy.
Yeah.
Rather than this being this power over knowledge. When people, they don't say it so much, but best, doctor.
The older generations still very much have that, I think.
And I think being aware of when I was a junior doctor and people would say, oh, you're a bit young to be a doctor, aren't you? So it was almost like I put on this jacket, this kind of mask to bolster myself in this script. And now I'm really excited and curious when a patient comes with research and wow, I might learn about, I'm open. The more I learn, the more I realize I don't know a lot. And just being a lifelong learner.
I'm really curious to know, how has this not fitted with other colleagues of yours? Because I imagine that there might be some comments about the way you are choosing to practice medicine. How have you found that? Are colleagues accepting of what you're doing, or has there been a little bit of like, oh, Jo, she's a bit fringe, or what has your experience been?
I guess over time, I've evolved, and I've always been a contractor if I've been in a practice. For 12 years ago, it would be people just wanted the script. And then I'd talk about mindfulness, and it was like people had already glazed over. They just wanted a quick fix. There were the odd few people who would come back and say, "Oh, I've been doing this,
Great.
and it's really helped me." And then I'm kind of thinking about talking about somebody with a cough and like, "Oh, are you still smoking?" And they go, "Oh, yeah." And I'm, that coach way of saying, "Hey, look, I'm not here to judge you," and finding whether they're ready to make changes, that it helps with the nicotine helps with stress. Okay, well, let's see how we could relieve stress, and talking to patients about how much money they would save. Yeah, just meeting people where they're at, and it's like, okay, yeah, I understand that. I'm here to support you in whatever way we can.
Mm. Mm. And so how did your interest start in psychedelic assisted therapy? How did that come into your way of practicing, or at least being curious or inquiring about it?
Oh, so many of the teachers that I was following were talking, like 3, 4. I was like, oh, another one. I should look into this. And I just happened upon the Mind Medicine Australia website. I was ready for a change. My sons are grown up, I've got less responsibility. It was a bit of an adventure to go to Australia. And it was very interesting how I think there was about at least 40 of us. So there were counselors, psychologists, psychiatrists, and just how they opened up. So there was still a lot of data that we went through, and then we watched videos of therapy sessions, and then really opening up. I took some cacao with me. So we did, as our training, we did breath work. We did a beautiful 3-hour holotropic breath work where we, in threes, we took turns. So 2 of us were sitting, if you like, being the therapist. So we were then able to be part of a study for well persons through Monash University. So that was also part of it. I guess my personal experience of psychedelics came from being in university when the rave culture exploded, Manchester, Sheffield, and then more recently being an inadvertent trip sitter for people within my community, and actually seeing how those people lit up. Something opened up for them, and then opening up a path back from maybe a dark place of trauma, and opening up a path of healing.
I was involved very briefly with the Auckland University research on psychedelic assisted therapy, which was fascinating to be part of. It sounds like your journey came from a very personal space, and the changes that you've brought into your medical practice have really come from a very, very personal space. And I think that most cases, this is how it occurs. It doesn't really come externally to us. It comes from an internal place where we experience maybe a challenge, but then we experience a growth, we experience some healing, and then we're like, oh, once we've experienced that, to actually share and encourage and invite other people to take part. And this doesn't come from a textbook.
No.
Yeah, I think that's so fascinating that other people I've spoken to as well, their changes in the way that they practice has come from personal growth and personal experience. And as challenging and as difficult as that is, it is such an incredible gift to then be able to say, I've been through this too, and here's what I've learned, and here's what helped me, and maybe I can help you. doesn't really fit into the medical model. But I think there's a lot more people that are allowing those boundaries to be a little bit blurred, and it's not a robotic script, as you say. So one of the things I understand about, if we go back to the therapy and the psychedelics, and one of the things that that really changed my mind about psychedelics in the way of therapy is reading Michael Pollan's book, How to Change Your Mind. I was very like, oh, I don't know about this, so I don't know if this is a very good idea. And then I read his book and I was just like a complete convert and saying, we need to be investigating this. Why aren't we doing more research? We really need to be bringing this into psychiatric treatment, because Lord knows what we have isn't working very well. And the research around this that they've done back in the 60s, or 50s even, 50s, 60s, 70s, seems to be pretty sound and pretty amazing. So I'm very pleased that we're getting into the research again. And you've really mentioned this briefly, but the other thing I'm always interested in is that when you have a experience or you have a therapy session, and this is another thing we have to be careful for, that it doesn't get put into a medical model, because it's very much about set and setting, isn't it? I understand.
But that's a little part of it. So set is the mindset. So that's where the preparation is so important, that somebody has the tools to navigate potentially challenging experiences. So we might teach mindfulness, breathwork techniques. So my vagal nerve biohacks, I talk a lot with patients about breathing, filling your belly when you breathe. So I can drop that mind-body connection. I can drop somebody's blood pressure by 20 by just getting them to do that. That's my own little clinical research trial.
Yeah, absolutely.
Yeah. So we need somebody for the therapy to be optimal. We would screen out for intense suicidal thoughts. We're preparing somebody. So we need the nutrition, the gratitude, the fresh air and exercise, cold water immersion, has been studied to saunas to improve mental well-being. Personally, I prefer a warm bath with Epsom salts.
We have both sauna and cold water immersion at the beach here, and sometimes, yes, I think I prefer the sauna myself, but some days, actually, I do find that the cold water does reset the brain. Like if I'm, whatever mood I'm in, I get in that cold water and there is nothing else that I'm thinking about in the entire world apart from being in that water. So it is a way of really resetting the mind. Everything else disappears.
Yeah. So the way it works, it gives the nervous system a shock and it goes from stress mode to relax and digest. It just kind of goes to default setting, I guess. So that's how I like one description of psilocybin therapy. So that's magic mushrooms. So it's been described as a mountain receiving a fresh coat of snow. So that when choosing a path down the mountain, we don't just need to go on piste. We can choose a new way of doing things. There's still a lot of research going on with how psychedelic medicines work. So I guess we've got the classic psychedelics would be magic mushrooms, psilocybin, LSD. So there's less work. They work similarly to ayahuasca, which has been popularized. There is some research starting has been approved in the US for ayahuasca. I just really hope that there's that sacred reciprocity, and honouring of the plants and the forest with that. So yeah, the classic psychedelics, and also so we've got MDMA, which is more an empathogen. So it's been shown to reduce activity in the amygdala, our emotional center of the brain. So it is quite effective for PTSD, traumatic experiences, because it means that the person is able to look at that trauma rather than without the medicine. They might get too overwhelmed to even be able to go there. So it's part of the medicine is part of therapy. Ongoing therapy with the same person would be good. So there's, these retreats, you kind of do that, to get transplanted for a weekend, and then this is where the integration specialist can come in. So I am able to offer that to people that have had experiences where they're struggling to make sense of what happened to them. So we've got MDMA. Ketamine is legal in New Zealand, so it has been used. There is a push by, I think in the US, to actually push it without therapy.
Right. Doesn't seem nice.
This is my concern, is that it's, particularly in the US, it's been seen as an economic growth industry potential. So basically making money for privileged people that can invest in this sort of thing. So that's what I would dearly hope. Here we can avoid that being just for the privileged people. So this is the problem. It's been, so MDMA has been legalized as a therapy for PTSD in Australia, and psilocybin for treatment-resistant depression. So it's just purely that the research had come out for those two things. So it's certainly looking like psilocybin can be effective for most of the mental health disorders. I'm waiting excitedly for research coming from Imperial College London for psilocybin therapy for anorexia, which we all know is a very can certainly be very distressing illness and very chronic.
So and life-threatening.
So potentially helping with those ruminating thoughts. So there's lots of theories of how psilocybin psychedelics might work. So they all seem to activate the 5-HT2A receptor. So this receptor is widespread within the brain, and when we compare that to the treatments we already have, which tend to be serotonin reuptake inhibitors, SSRIs, so your Prozac and that family of medications, they just basically increase the amount of serotonin in the gap. So in the gap between those nerve endings. So it's not surprising that we might notice a bit of an effect, whether that's a placebo because take this will and I see people giving prescriptions because doctors are uncomfortable with emotions. As a society, we're uncomfortable with strong emotions, So it's easy. We get them out of the room.
Yeah, and I think people themselves also want a prescription, don't they? Because they don't want to feel how they're feeling. And we have the expectation that we'll go to the doctor and the doctor will make us better with a pill, mostly.
A quick fix. Yeah.
A quick fix, yeah.
Yeah. So they have shown on MRI that with psilocybin, compared with placebo, there's this connectivity in the brain. So there's been a lot of talk about resetting the default mode network, but actually a lot of medicines also do that.
You said the default mode network, and I know a lot of people are going to go, the what? Are you able to explain that?
So I guess that is so if we go back to attachment in our early experiences, we can choose, when we're born, we're like the curious bundle of wonder and awe, and then we need to survive. So we get feedback from our caregivers whether it's okay to be our authentic self or not. So this is how we pick up often toxic beliefs that we're not good enough, that we have to perform to get our needs met. So yeah, these default ways of being comes from survival. And if we think about trauma not being what happens to us, but the way we have to adapt.
Right.
Because of that event. So if something scary happens to us and we have a safe adult who believes our experience and then keeps us safe, we are likely to be able to heal from that more easily. But if we've got a sensitized nervous system because of being exposed to drugs or alcohol in pregnancy, or stress during pregnancy, family violence, or even we know that generational trauma from the world wars is passed through our DNA. We're getting quite good evidence of that. And Gabor Mate discovered that he was addicted to work, so addictions are a defense, and this is, my hope for society is that we can reset our dopamine reward system so that we don't need to scroll, to numb, to gamble, to eat toxic food. Alcohol is it's legal, it's acceptable, but it's a toxin. I'm shocked how many parents think it's okay that their children drink.
Or binge drink, at least, that culture of binge drinking.
And, under the age of 18, we know it's permanently damaging to their brain.
Yeah.
We know that cannabis can permanently reduce the IQ by so many points. So both are cause adversities, but it's that, we did it.
Yeah. We did, just like we didn't have seatbelts in the cars when we were younger, and we're fine. Yeah. So
I did want to go back there to the trauma conference was here in Christchurch in March, and we had Bessel van der Kolk, and he describes psychedelic assisted therapy as equivalent to antibiotics being discovered.
Wow.
So he was part of the MDMA trial. He was very skeptical because his patients had very deep developmental trauma, so early childhood adverse events, and he saw how, that it's the only thing in 50 years of his career that he's seen this profound change. So this, this is we're wanting to create resilience in our society, but these medicines can create transilience. We can transform and be better than before. So when counseling somebody about potential effects of psychedelic medicines, we have to say this might permanently change your worldview.
Yeah, I think that's so fascinating, isn't it? Because it can be something that is a life-changing experience for someone. And the other question I imagine that people are having is, okay, so we know that, alcohol has its downsides and we know that cannabis has its downsides. What do we know about the negative effects, perhaps, of psilocybin therapy or psychedelic assisted therapy? Because, we need to obviously look at the good and the bad of what could be.
Yeah, I personally resonate with psilocybin. So I think it's the least likely to be abused. And I think it's exciting because it's available, it grows naturally all around the world. So this hope that it's not going to be this expensive, patented product. And I guess I just want to have a caveat that before picking and consuming mushrooms, to be absolutely sure that that you're identifying it. There was a case in Australia where there was a fatalities from that. So drawing on a knowledge base with that. So the incidence of HPPD, which is hallucinogenic persisting perception disorder, happens in less than 2% of cases with psychedelics. So it's just being aware. We don't necessarily, because it is such a low risk, we don't necessarily need to make a big thing about that. So pretty mild side effects like headache, nausea, the potential for quite a challenging experience. And then we would discuss that people might feel disappointed if they've prepared for this huge experience and it's quite tranquil, and so that's where the integration phase of the therapy. So it would generally be at least 3 preparation, 3 integration sessions, and weaving in the models of therapy so that people have a benchmark. So as a therapist, we would go through timeline of potentially traumatic, sensitive events in the life. So we're familiar with that person's history, what might come up. So we might need to ask that person to move towards that experience, to be like, it's okay, you're safe here, be curious. So having that heads up with a timeline. And so internal family systems really resonates with me. So I'm planning on ongoing training with that. So that's really looking at early experiences. So that in a child, so those early childhood experiences, but any other wounding that we might be protecting. So in IFS, Addictions are felt to be potentially what are called firefighting, reactive parts that are really, they come out when that inner child, they're so scared that the inner child can't take anymore, that they're there to numb and protect. Whereas the IFS model is really nurturing the self energy. So that's the compassionate, curious, calm, clear adult self. So actually, hey, it's okay now. And
We're safe.
I guess it's safe, and helping people reparent themselves. So it's not putting a judgment on our caregivers. They did their best, but actually giving awareness to what was it that a younger self needed at that time.
And didn't get. Yeah, fascinating.
So the other therapy that's been used with psychedelic assisted therapy is acceptance commitment therapy, which kind of is used quite a lot in the health coaching. So that potentially would fit very well with people with that training. So that's looking really about what are our values? What are our values, and how can we move more towards that? So this is the thing with the PAT happening in Australia, is it's very, very expensive because the approvals have been set, so a psychiatrist has to be present.
Right.
Not actually in the room, but on site. So we're looking at therapy for 1 or 2 dosing sessions being $20,000.
Wow. Gosh.
So MMA are kind of subsidizing. They're looking for philanthropists, donations to support that. But that's my hope for us here in Aotearoa, is that we can have a wide accessibility. So yeah, hopefully we learn from Australia and the rest of the world and create, we're unique, we're diverse, and we can hopefully.
Yeah, that would be so fascinating. And I do think we've got that advantage of the cultural wisdom and that we can bring this in, because I think a lot of Europeans don't have, I could be wrong or stepping out of place by saying this, but we don't really have a deep cultural wisdom. I don't have any sort of traditions of, medicine or otherwise. I mean, maybe way back, my parents are Dutch and I'd have to go quite a few generations back. I don't know any way that we used plant medicine, whereas in many of the traditional cultures that are here now, we can see that they are using it, and it's still part of who they are. Yeah, so it might be something that we can, hopefully in a cohesive and cooperative model, that we can sort of tap into and bring it into what could be amazing healing modalities for people that are struggling. Fantastic. Thank you so much. Is there any last words? Is there anything else that you want to sort of say, or?
Yeah, I'm just hopeful, that sense of hope.
Yeah.
So for anybody out there resonating with this sort of therapy, what you can do to be ready is to put into place daily self-care, nourishing food, like I said about the breath work, sound journeys. So we know that sound frequencies are healing, that I've had some quite expansive altered state experiences just with those things. So
Yeah.
it's like being open to possibilities of what, coming back to our own intuition, and being disconnected from culture. But European cultures, we had herbal medicine, we had the witch hunts and that sort of thing that suppressed.
Yeah, that's how far back we have to go.
Yeah, and the Druid, the Celtic cultures, my little homeland of Yorkshire probably had a little area that wasn't invaded. We come from the moors, so it's about all of us to be indigenous as that respect for our environment, for the nature, and journeying with the wisdom of the plants. There are teachers within our communities that can teach this.
Yeah, fantastic. So, and if people want to get in contact with you, how do they do that? Or if they want to follow you on social media?
So I have Dr. Jo Wholehearted on Facebook. My website is just jobattye.com. I have lots of resources that I can email out if anybody wants to just reach out on my website. So it's really bringing knowledge, simplifying it, bring it into wisdom.
Fantastic. I think we're so lucky to have you, you've trained in the psychedelic assisted therapies, you've got a deep interest, you are, I think, paving the way forward. And we're very lucky and blessed to have you here, that we're going to use you as a resource in the future for sure. So thank you so much.
So just a final comment is that the more people that can open up to an expanded consciousness and expanded awareness, then the less mystical gurus who like themselves on pedestals can have power over us. So actually the meaning of life can be really simple, just back to basics. Gratitude, not spiritually bypassing that all is good, but actually knowing that the world is quite terrifying in places, but dwelling on that doesn't serve. So I think rippling out well-being tips and tricks as the way we heal the world. Coming into circle, sharing vulnerably.
Fantastic. This is a sense of hope for sure. Wonderful. Thank you so much, Jo, and I appreciate your time on the Sense of Hope podcast, and I'm sure we will be keeping in touch and talking again soon.